and educational purposes only. It does not substitute professional medical advice. Imagine a disease that attacks the brain within hours, causing severe headache, high fever, and neck stiffness. In its most severe form, it can lead to death in less than a day. We're talking about meningitis, a silent threat that doesn't choose its victims. Despite the available vaccines, many people are still unaware of the real dangers of this infection. Do you know how to identify the warning signs and protect your family? Today, we'll unravel meningitis, its causes, and how you can defend yourself against this treacherous disease. Stay tuned, because this information could save lives. Today, we're exploring a serious but often overlooked disease, meningitis. This condition involves inflammation of the membranes covering the brain and spinal cord, known as the meninges. Meningitis can be caused by various infectious agents, including bacteria, viruses, fungi, and parasites, and its severity ranges from mild cases to life-threatening situations. Due to its rapid progression and potential seriousness, meningitis requires quick diagnosis and treatment. In this video, we'll unveil the characteristics of meningitis, discuss its distinguishing symptoms, and highlight the available prevention and treatment methods to combat this insidious disease. What is meningitis? Meningitis is the inflammation of the meninges, the three membranes that cover and protect the brain and spinal cord. This inflammation can be triggered by different infectious agents. Bacterial meningitis, although less common, is the most severe and can lead to severe complications and death if not treated promptly. Viral types are more frequent, generally less severe, but can still cause serious health issues. There's also meningitis caused by fungi and parasites, which is rarer but dangerous, especially in individuals with compromised immune systems. Understanding these variants helps identify meningitis and respond appropriately to minimize health risks. Symptoms of meningitis. 1. High fever. High fever is one of the first and most common symptoms of meningitis, signaling the body's response to infection. This fever usually appears suddenly and can exceed 101.3 degrees Fahrenheit (38.5 degrees Celsius), accompanied by chills and intense sweating. The elevated temperature results from the inflammation of the meninges and the release of toxins in the body, which stimulate the immune system to fight the infectious agent. Persistent high fever, especially when accompanied by other symptoms such as headache and neck stiffness, should raise suspicions of meningitis. Unlike fevers associated with mild infections, the fever caused by meningitis is resistant to common treatments like antipyretics, and its continuous presence indicates the need for immediate medical evaluation to rule out this potentially lethal condition. 2. Severe headache. Severe headache is a hallmark symptom of meningitis, resulting from the inflammation of the meninges and increased intracranial pressure. Unlike common headaches, this one is severe and persistent, often arising suddenly and rapidly intensifying. It is described as a crushing pain that affects the entire skull, often accompanied by nausea and light sensitivity. This headache does not alleviate with simple pain relievers and can be exacerbated by sudden movements or physical exertion. In combination with other symptoms like high fever and neck stiffness, severe headache is a critical indicator of meningitis, requiring urgent medical attention to confirm the diagnosis and begin appropriate treatment. 3. Neck stiffness. Neck stiffness is a classic symptom of meningitis, characterized by difficulty or pain when trying to move the neck, especially when bending the head forward. This stiffness occurs due to the inflammation and irritation of the meninges, which are the membranes covering the brain and spinal cord. Patients may find it difficult to touch their chin to their chest and often describe the sensation as a locked neck. This stiffness is a warning sign that helps differentiate meningitis from less serious infections. Combined with symptoms like high fever and severe headache, neck stiffness suggests the presence of meningitis and requires immediate medical intervention to confirm the diagnosis and initiate treatment. 4. Nausea and vomiting. Nausea and vomiting are frequent symptoms of meningitis, often associated with severe headache and increased intracranial pressure. These symptoms result from the inflammation of the meninges, which affects the vomiting center in the brain. Patients with meningitis may experience persistent nausea and episodes of vomiting that are unrelated to food intake and are not relieved by common nausea medications. The combination of nausea and vomiting with other symptoms like high fever and neck stiffness should raise suspicions of meningitis, especially if these symptoms appear suddenly. The continuous presence of nausea and vomiting requires immediate medical evaluation for early diagnosis and appropriate treatment to prevent the progression of the disease and its complications. 5. Sensitivity to light, photophobia. Photophobia, or sensitivity to light, is an uncomfortable symptom of meningitis, characterized by pain or eye irritation when exposed to light. This symptom occurs due to the inflammation of the meninges, which increases the sensitivity of the optic nerves and causes visual discomfort. Patients with photophobia may prefer dark environments, closing their eyes or avoiding bright lights to relieve the pain. Photophobia is distinguished by its intensity, exacerbated by bright lights or sudden changes in illumination. This symptom is particularly relevant when associated with other signs of meningitis, such as high fever and severe headache. Recognizing it helps differentiate meningitis from other diseases, highlighting the need for immediate medical evaluation for rapid diagnosis and treatment. 6. Confusion and drowsiness. Confusion and drowsiness are concerning symptoms of meningitis, indicating that the infection may be affecting brain function. Confusion manifests as disorientation, difficulty in maintaining a coherent conversation, or answering simple questions. Patients may appear apathetic or have memory lapses, while excessive drowsiness can lead to deep sleep or difficulty waking up. These symptoms reflect the impact of meninges inflammation on the central nervous system, reducing cognitive capacity and awareness. The presence of confusion and drowsiness, combined with other signs like high fever and severe headache, demands immediate medical attention, as it may indicate worsening meningitis and increase the risk of severe complications, including coma. 7. Rash. A rash is an alarming sign, especially in cases of meningococcal meningitis, and may indicate that the infection is spreading throughout the body. This rash appears as small red or purple spots that do not disappear when pressing the skin, known as petechiae. As the disease progresses, these spots can expand and form large areas of bleeding under the skin, called purpura. The presence of a rash reflects the bacteria spread in the blood, compromising blood vessels, and can quickly evolve into a condition known as meningococcal sepsis. This symptom is a critical medical emergency, and when identified, requires immediate intervention to begin antibiotic treatment and prevent fatal complications, such as septic shock. 8. Seizures. Seizures in meningitis patients signal that the infection is causing severe irritation or inflammation of the brain. These epileptic crises can range from mild tremors to intense and uncontrollable body movements, reflecting electrical dysfunction in the brain caused by the inflammation of the meninges. During a seizure, the patient may lose consciousness, experience muscle stiffness or sudden movements, and, in severe cases, lack response after the episode. Seizures are especially concerning in infants and young children and can lead to neurological damage if not treated immediately. The appearance of seizures, along with other symptoms like high fever and severe headache, indicates the urgent need for medical care to stabilize the patient, control the infection, and minimize the risk of severe or permanent complications. 9. Bulging or tense fontanelle, in infants. A bulging or tense fontanelle is a specific symptom of meningitis in infants, indicating increased intracranial pressure due to inflammation of the meninges. The fontanelle, or soft spot, is the soft area between the bones of an infant's skull, which is normally slightly concave. When there is excessive pressure on the brain, this area can become tense or visibly elevated. Besides the bulging, the area may feel pulsating to the touch. This symptom, often accompanied by irritability, inconsolable crying, and lethargy, is an emergency sign. The presence of a bulging or tense fontanelle suggests meningitis or another serious condition requiring immediate medical evaluation to prevent permanent brain damage and other severe complications, highlighting the need for urgent and precise intervention. Recognizing the symptoms of meningitis, from high fever and severe headache to more specific signs like rash and seizures, is crucial for early detection and treatment of the disease. Meningitis can progress rapidly, so awareness and immediate response to symptoms are essential to save lives and prevent severe complications. If you or someone close to you exhibits these symptoms, seek medical attention immediately.